Okay, 131, shall we resume with the finance committee? Finance.
Like we're gonna mark them, okay, IT budgets.
That where we're going next?
Mm-hmm. Hey Jim, do you wanna start with an overview?
Whatever way is easiest. Sure, okay, so as far as the upper portion there, lines 111 through 156, we really don't change too much on those. When it comes down to lines 213 and below, that's where we'll, I'll go through it here real quick. So line 213, which is the IT consultants, for 2014, we had that line at 12,000. We're asking to increase it by 3,000 to 15,000. That is just to keep up the costs. The IT support, which is 216, currently it's at 55,000. We're asking that one to go up another 5,000 to 60,000, based off of licenses costing more. See IT communications, that's currently at 26. We're asking for 25 on that one. It's only a change of $100, but that's at least something coming back. With the insurance claims, we're hoping to stay at 0. As far as line 249, which is IT repair and maintenance, we're currently at 3,000, and we're not asking for any change on that. And with 311, where we've got the IT postage at 150, we haven't had any usage at all this year, which is good. So we're looking to drop that down $200.
Are you saying IT people use emails instead of?
We try to.
Email?
We try. Same thing too is actually the next line is kind of what he's talking about, with the central duplicating. Again, we try not to do too many prints or anything like that, so we're going from 150 down to 100 again. The office supplies, we're currently at 2,000. We're not asking for any change there at all. Same thing with IT travel, there's no change there. Or IT training, no change there as well. Line 340 is the IT equipment. We currently, last year's budget was 5,000. We're not asking for any changes there either. And the same thing too with line 810. That was at 50,000, and we're not asking for any changes from there either. So the big ones that we did ask for changes on would just be line 213 and 216. Line 213 was at $3,000, and 216 was $8,000. Actually, maybe Jamie could answer this. We had a thin claim for a while. Is there still any money in there that actually cover these instead, so that it wouldn't cost at all?
It was very minimal.
Okay. I remember, I thought it was like 11,000 left, and that would cover the request that I had.
So there's like 19,000 that hasn't been like allocated to any specific project, cause like there's some that's unspent for like the NAS system, the Gosser, OSSI upgrade, the laptop UV cleaner. So it's been allocated, not purchased yet. Yeah, and we just had highlighted a few things here, just with the consultants, cause at that time too, you, we're asking for an additional position, and so, and the consultants line was going up. The support is highlighted because we need to, on our end, reallocate that between the subscription principal and interest because of that change in the accounting standards. And then we were wondering, with that equipment, are you going to spend that full $50,000 this year?
The full, no.
Okay, so how much are you actually going to spend this year?
I would have to see what else we've got planned for us here.
Okay. Cause that $2,502.45 that's there, what is that for? 'Cause this is it's intended for equipment over $5,000.
Yeah, I'm guessing that was just put into the wrong category. I can go back and find out and see exactly what it is, because that 50,000, it's my understanding, that's supposed to be our rollover every year, so then when we get to that, the 5th year, we've got the money. We've got the money already ready for the servers and everything like that, so we don't have to come back and ask for a large chunk of money.
Yeah, that was, Red Cedar Electric material and labor for hookup and server room.
Yeah, that should be in there.
Okay, so if you send us a journal entry, we can get that moved out.
I thought we were doing about 35,000 for the budget, for the future hard drive upgrades and things like that. Per year.
Well, for 2024, we had budgeted 50,000. But that's another reason why I had highlighted in yellow, just because, depending on how budgets shake out, it's up to you guys how much to, continue to allocate, and it can be addressed each year separately too. So.
I don't know, it seems like I don't remember. It must not be that weird. What's your estimate again on the IT equipment every so many years, and what was your estimate on the dollar amount, Jim?
It's usually between about 225 and 250, but it's hard to say what it's gonna be then. That's why we felt, pretty safe with going with the 250.
But how many, because we just did it, what, last year?
Yep.
How many years is this good for?
Typically you look between 4 and 5. I think the last one we pushed about 6 or 7.
Okay.
Any other questions, concerns? It's way too quiet here now.
Looks like John's studying, so.
Okay.
I was just trying to read the IT specialist, trying to compare it out. See, that's the wages.
Yes, yep. That's for 2.
else got any questions? If not, let's move on.
So HHS is coming in too. So before that, I'll maybe like kind of cover this sheet, if that's okay, kind of give you guys an overview. So this is like, I kind of briefly touched on it before. So what's coming into this 2025 proposed by finance is what's currently in those budget sheets for a levy ask. So if there's a 0 on there, that just means that that particular budget doesn't utilize any levy. And Sky and I tried to add notes as far as like, you know, reasons for why a budget would increase significantly or decrease between 2 years. So then when you get to that last page, it shows that we need to cut 756,653, which is only part of the amounts that we really need to cut, because a few lines up from there under revenues, there's the used from general fund. So the last few years, like it started before I took this position, that we were using a 5-year average of the general fund revenues in excess of expenditures for the, you know, so basically our net income that we, from previous years, that we would use to apply against this year's budget, because we try to budget conservatively for our revenues. So the last several years, we've come in under budget overall as far as revenues in excess of expenditures. I'm really not comfortable with the number that's in there, because our 2023 operating results were artificially high due to, you know, the wind down restrictions being released, the timber sales being better than expected, investment income being better than expected. Right now, we have no reason to believe that we're going to blow our timber sales out of the water. We think we'll, you know, meet our budgeted amount, but I don't, you know, we're not going to hit $2-3 million. You know, we obviously won't have the release of restrictions on the wind down funds, but we have additional revenue from that. So, you know, that almost $4 million, that number needs to come down. But then, whatever we reduce that by, we have that 756,000, and we also do not have anything in contingency right now, because we usually budget in contingency for wage increases, as well as, you know, about $200,000 for general contingency. So, we're thinking we need to put probably $500,000 into contingency yet too. So we have well over $1 million that we need to figure out where to cut out of this budget. So, you know, when we were looking at the highway budget this morning, I said, you know, we'll probably wanna revisit this. Well, there's that $500,000 of levy that's in that equipment fund. Depending on the equipment purchased, if we're purchasing a big plow truck, we can use bond proceeds for that instead of our operating levy. And so then that frees up potentially $500,000 of our operating levy, that we can use that instead.
I think their plan is to buy 2 projects, so.
You know, I don't think we should be using bond funds to pay for shop trucks. You know, the smaller vehicles, but for those bigger haul trucks that cost $300,000+.
Yeah, I went back on timber sales being
Oh, yeah.
crazy.
That's where we at.
The last time we bid out, some of the sales didn't get bids on them, so we put them out for bid. 4 or 5 of them. Like, more than your average, you know, every once in a while you get one that just undesirable, but there was a few.
Bessie Lumber is shutting down.
3 plants.
So right now, posted through the week before last week, we were at 1.36 million. And I believe we had budgeted for $1 million. So we're over budget, but we're not, you know, going to be $1 million.
Yeah, we're not gonna be $1 million like we were before, and something changes in the market. Going into 2025, we're still, a lot of our revenue is coming from sales that were sold 3-4 years ago, because the sales are good for 4 years. So now less bids on less sales, going forward, you're only doing less until something.
It's gonna be a ripple effect going forward, is what you're saying? Possibly.
Possibly, I mean, I like to hope not, but to be realistic, it's very possible that it just gets worse.
Our carbon credits are coming though, right?
We got the carbon credit people will be at our meeting tomorrow.
Oh, do ya?
You should come to the meeting.
I wish I had time, I can't.
We can get some gym questions at them.
I'd love to.
You're all gonna make a mason jar of hair.
Yeah, you're gonna bring us a free complimentary carbon credit.
Put it in my pocket.
But yeah, looking at this, I mean, and you'll get to the presentations, like HHS, their budgets are up by about $1 million of levy ask from 2024 levy ask because of high cost placements. Cost of food with like, home delivered meals and congregate is part of it too, but not, the biggest part is those high cost placements, which we are
Those
mandated to.
Yeah, they're really out of our control, and you really don't even know how to budget for it, or you have a bunch of cases that are high cost, how they don't, or you don't. You just gotta roll with whatever comes your way.
And then, you know, the sheriff and jail budgets are up quite a bit too, so that's the, you know, the biggest reasons for our increases. So, just something to kind of keep in mind, but we have, there needs to be a lot of money cut out of these budgets. I mean, are you guys okay with us taking, you know, that 500,000 of levy out of the equipment fund and putting bond proceeds in instead?
Wasn't that meant for road construction projects?
No, I'm talking about, so we borrowed $6 million.
Streets.
Yeah, it's coming next
The
month.
tower upgrades and all that stuff in there.
Yes, so there was $3 million for road projects, but then there was $3 million for the tower upgrades and other capital projects, so. Unless they're gonna come in under on those road projects, we could, you know, but otherwise we take it out of. But then there might need to be other projects that
No,
were.
we wanna do as much road projects as we can do.
So then there might be other projects that were in the capital improvement plan that are not going to be able to get done in 2025, because some of them would be funded by bond money, and we only have so much bond money, so. Right now,
As a capital improvement plan, we're gonna go on a case by case thing.
right, but we want a budget for those items too.
Right.
So like right now, let me find the capital projects for the north bathrooms at the fairgrounds are on there, to utilize some bond proceeds, as well as the swinging bridge at Trails End. Cause there was, I believe, $25,000 allocated out of contingency this year to repair it, to be able to utilize it, but they would like to reconstruct it, so for more of a long-term solution. So right now I have both of those projects in capital projects for 2025.
Does mine come too?
So
I thought that money came out of that one program.
part of it, so, but with, it's, so 64,000 would come out of, LACAF funding, but then the remainder would have to be paid for with some other funding source. So it'd be 310,000 less than 64,000. That would be from LACAF.
310 plus the 64?
No, less.
Or 64 out of the 300,
46.
Yeah, that's what I think, so.
I don't know, we don't know exactly how much the tower upgrades are gonna cost.
When the officer clears from that fallout,
Um,
he'll go back.
fiber to the sites and everything there. That's additional costs outside of what we getting the fiber to the sites, right, Ashley?
Oh, I'm sorry, I was.
Okay, so for the tower project, getting the fiber to the sites was not part of the proposal from.
Right, the county had to do that on their own, but that was factored into that final number.
The proof number, right?
Yes.
So we might have some, you know, we budgeted 250,000 for that, but we might have some left over.
We might, yeah, there's a few dollars there, but I wouldn't bank on it coming under that very much.
All I can say is that the quotes, once the sheriff's office had trimmed some off of it, it did come in, like, our quote was under what we were anticipating going with GenCom, over the other vendor. I do know, that the Motorola equipment came in a little bit higher than we anticipated by about 2,500, I think. So it'll just be a constant give and take as the project goes along next year.
But then, so we had budgeted 2.5 million of that 3 for the tower project, and we had 500,000 for other projects, so, that 500,000, some or part of that could be allocated for equipment and highway.
But then we don't have money for, bathrooms.
Right. That's just, you know, some of the things to think about.
That you'll have to make, yeah.
Well, we have HHS here now.
Jeremy, we're all out of money.
Yeah.
I knew I drew the short straw by 2 o'clock.
You got $50, where do you wanna put it?
$50. That's actually a little more than I thought you were gonna tell me. So, how's everybody today? Doing good, Mr. Caleb won't even look at me. I do have a contract for years now. So, I brought Laura Weimer and Ashley Nelson, with me, so I figured they'd get little reinforcements. This is the closest Laura and I have ever been, right now, so, I guess my question is what would you like me to go through? We have 40 budgets in our entire budget. And so I have notes, I have narrative, I have anything you'd like to talk about. We have obviously some things that we could draw your attention to that put us in a position where this is our highest levy ask ever. And it gets us over $1 million for our levy ask. I guess you guys know me, I can talk as long as you want, but the things I would draw attention to is, I believe, if we just wanna start with the 418 budget, that's gonna be our, I'm sorry, 417, I say that every time. 417, I believe, is our home delivered meal program. And so if you scroll through that, there's a couple things there that the wages, insurance, benefits. A couple years ago when we did Carlson Detman, that was a humongous thing, is that we were able to pay our drivers, pay our staff a decent wage. As a result, we have the results right now is that we are fully staffed. Knock on wood, we're fully staffed in there, and it used to be a revolving door, and so those are some good things, but there's a cost impact there. In the middle section, when you talk about expenditures, the cost of goods sold is humongous, it's way up. And so you can see that that's $117,500. At the bottom, I just have some numbers for you so you know what we're dealing with in reference to home delivered. We have 99 customers that are considered homebound in this program, and they are receiving a meal a day, 5 days a week. We have a congregate site, which is the 417, scratch that, the 415 budget, that we're on average serving 652 meals to folks at senior centers throughout our county.
Hey, Jeremy?
Yeah.
We used to make the meals for the jail
Yes.
here, but the reason we stopped is because we didn't have staffing, if I remember
there were a multitude of factors, but that was a big one, is that you're talking 7 days a week, 3 meals a day. I think the big thing was Saturday and Sunday coverage, to be able to do that. Plus we had an evening meal that we had to get that was hot.
For staff now, maybe it's time to relook at, rather than contracting that out.
My fact checker, we had more staff than we do now. The existing staff that we're talking about in this program, and again, it's not off the table, but I'm not shutting it down by saying that, but
Sounds like it.
kind of feels like it. The staff that we have now running this program are the Paranormal's core staff. We had 3 additional FTEs. I think we have 3 additional FTEs that were associated, that were just designated to the jail staff in this program. I can get you some numbers, Jamie might have those numbers as well, I don't want to put you on the spot, but I know we had like 126,000 meals, or what was it? Maybe quick math, we had 90 meals a day on average.
And it would be less than that now because our population's more like 18 or 19.
Okay. So yeah, I mean, it's something that, we celebrated when the jail meal went to a contracted entity, because it was hard to keep staff. It was hard to, our ADRC manager was showing up on Saturday and holidays to get the meal because we didn't have staff. So again, here and there, consideration. We're only 5 minutes into this thing, Mr. Undershoes. But yeah, so again, a lot of meals are happening in the county, being home delivered to folks that qualify, and then also the congregate sites. Congregate sites are specific to, getting folks off their couches and for socialization and those kinds of things. So, let's see. Vehicle repairs, mileage, all of those kinds of things are super expensive. The highway shop does all our maintenance and our wear and tear reviews and our tires and all those kinds of things. In fact, our vehicles
aren't in the fleet.
No, they are purchased with, grant dollars and trust fund dollars, so they need to be separate.
Okay.
That's one thing we do have a healthy allocation of, is we do have our vehicle trust fund. We have $30,000 in there in the 418 budget. So that's a good thing. So as we have things that break down and purchases that we'd like to make, we have. So the 2 biggest, there's 3, probably 4, widely underfunded mandates that we have. You'll hear me say that, I say it a fair amount. County Veteran Service Officers, you can go to our 490, I think. That might be child support, that's child support. 480?
Oh, 480.
Yep. 480 is our County Veteran Service Officer. If you scroll to the bottom, you can see that our revenue in that budget is, from the state, is $11,668 projected for 2025. And that's a $100,000 position. And so we just have 1 FTE serving all of our veterans in our county. We have a little bit of support from our front gate, from our reception area, but pretty much that is a 1-person show. Children and Family Services, 474. I'm gonna get into a little meat and potatoes here. Children and Family and our Adult Services. Children and Family Services is very important, obviously. We're dealing with a lot of things there that impact our community, a lot of prevention types of things. But first and foremost, you have staff that are exhausting efforts to prevent the removal of kids from their home. And it's very difficult. We have some very difficult situations in our county. We have non-traditional solutions that we have to come up with. But we're talking safety services, and those are things that are very, very important. These are high impact jobs, they're stressed, the cases are super complex these days. And with saying all those things, we have 10 youth in out-of-home care in our county. We have 23 plus kids that are being raised by some type of kin. And then in addition, we have 15 child in need of protection and services cases. The staff is doing an exemplary job in that department. I'd say that even if Ashley wasn't sitting here as the supervisor, but they are exhausting all resources to keep kids and families together in our community. And that being said, when a child has to be removed because of safety services, it's very expensive. There's treatment foster care, there's regular foster care, there's not that many regular foster homes anymore. But we have places like Lad Lake. Lad Lake is a residential care center that is $628 a day, because there's no other safe environment for that youth to be in other than that environment. We have one youth there. We have things like administrative rates within our treatment foster care system. That's their AMZO and overhead cost that gets paid. Anywhere from $78 to $98 a day per child. And we pay those rates because there's no other safe environment for that child to be in. We have a couple different sibling groups of 5 in our county that have had to be removed. So again, as you work through that budget, you can go up to the middle section where our contracted substitute care is, line 23. We're projected to be at $500,000 for 2025. We have a 12-year-old right now that could possibly be a second Lad Lake placement. Ashley and her squad is doing a great job of trying to divert that placement through other safety services. So it's very expensive, very much a real-time thing for us. If you go to number 463, that is our adult services. This handles all of our adult protection services, our mental health, our alcohol and other drug addiction types of services. A lot of the same story. Our community support program, which is our serious, persistent, mentally ill population. We have 13 folks right now that have consistently been receiving community-based services, living in their own home, living their best life with mental illness and medication management, psychiatric care. Those are all good things. We have a residency case that was determined that as a result, we're paying $650 a day for a person to be in a facility. Again, very much a safety concern for the community. So that's why they're in that more restrictive environment. We have 5 total folks in out-of-home care that are adults that we are paying for right now. And each one of those cases, just like in children and family, reunification is the best that we can hope for, is get them living safely in the community in their own environment. And so you can see within that budget that out-of-home care cost, line 20, that's our community mental health allocation. For as long as I can remember, we have received $103,374 in revenue, and you can see that our expenditures outweigh that. We have one person at Trumbull County Healthcare Center, which is a Institute for Mental Disease. We haven't had anybody there since 2016, but again, that's the safest environment for that person at this point in time. Let's see what else I got. Public health, 440. Public health has, again, a lot of mandated services that, have a bunch of little budgets that generally speaking don't take into account wages and benefits. They're more of initiatives in the community. But you can see there that, the levy ask there has continued to go up, primarily because of wages, benefits, costs, all those kinds of things. But that has historically been a high levy ask because of the minimum funding available. That budget does include our full agent worker. That person is the person that licenses all of our food facilities and tourist rooming houses and all those types of things in compliance with state statute. And so there is some revenue generated there. However, the state is now taking 11%, it used to be 10%, the state gets to keep 11%. I think they're projected to go to 12% next year, 13% in 26, give or take. I think there's some statutory changes there. But you can see we generate about $72,000 in that 89% portion. We did increase our fees. We went up 15% here in 2024. Two things happened. We needed to increase our fees that have not been increased in a long time. But we also didn't want to price out mom and pop from any kind of shops around the county and those kinds of things. But we had to take into account the rising cost of other areas. What else would you like to know? There's 40 of them. I can keep talking.
Well, we have some newer board members, if you wouldn't mind giving like an overview of each of them.
Sure. Did everybody get an opportunity, specifically if you're new, to take a look at the tabs?
I did not.
Okay, no troubles. There's so much,
Right.
okay? So if you want, I can just start right at the beginning.
And maybe highlight which ones have like mandated services versus.
Sure. If you wanna just hit the budgets tab for a minute, what you can see there is right on through, starting with drug court, which is, I'm responsible for
But the budget itself is within the district attorney one.
I just supervise the coordinator. That just kind of spells out what each budget is, and can kind of give you just a super quick just name to it. But like 410 is your congregate sites, and so we have Sheldon, Hawkins, and Bruce, and then we also have Ladysmith, which is separate, but that's where all the things generate out of, all of the meals generate out of there. But then they get delivered out to the sites, and that's where congregate occurs, and then the home delivered is throughout the county. 412 is the source newspaper. This is a nice, when you talk about like mandated versus non, so, you know, congregate, home delivered, source, those kinds of things, those are all non-mandated services. However, these are good resources, and we get donations, and you can see there's a fund balance with the source.
It looks like there's no levy,
Say it again.
there's no levy asked for the source anyways.
No, we that, way back in the day when that started, that was the determination that would not be a levy program, I believe. I believe that. 413 is like our service management. You can see where the jail meal, the jail AMSO cost was captured in here before. This is our service management is our is our overhead and all the, requirements that are held somewhere else in the individual budgets. There are some programs like WIC, this is something where Laura and I talk about this all the time. Some programs like WIC that have like a 10% allowable, like ANZO or indirect, depending on what they're calling it. And it's like our space and some of that kind of stuff, and meeting Laura and the reception staff. But you can't capture that whole 10%. They only let you capture 10% per month of what your expenditures are. And so, when you drill it down, you don't end up getting a full 10% of the $134,000 budget. But, so then in this area is captured. 415, we talked about congregate meal, home delivered. So, Kathy Walters and myself, Kathy is the ADRC manager, senior services manager. We've already talked about what we're going to do in home delivered as kind of brainstorming how we're gonna need to lower that levy ask, because that's a humongous levy ask, that the cost of goods sold, the cost of the staff and all those types of things have really skyrocketed. And so, we're already going to have to, of the 99 folks that are on that program, we're really gonna have to make sure that they're, continue to be eligible. Do they need 5 meals a week? Is there a way we can do like 3 meals a week and do some frozen meals, or, are they just maybe a Monday, Wednesday, Friday? Capping the program at this point in time and starting a wait list, sheer reduction of the program, may have to be an option. But that's a very hefty levy ask there.
Why did they switch from having county employees do it from the volunteers that were doing it before?
Good question. I think sheer willingness of folks to continue to do it was probably a good portion of it. I don't know that I necessarily remember a time when it was just strictly volunteer.
It was, I was one of them.
Okay.
Because we ran around and all the home delivered meals were volunteered, and then I think maybe it was COVID that they shut it down and said only county employees could do it, and then it never started again. And I think what you mentioned too, because churches were doing 2 weeks at a time, and it rotated and all that stuff.
Yeah.
And then that was cut out.
Yeah. I remember during that COVID time that, I did the city route, that was like 8 meals or 10 meals or whatever, but just to try to help out. I think everybody now, for the most part, is a paid employee, because you run out of those folks that are willing to donate their time.
Well, they cut them out. Just wondering.
Yeah, I'll have to ask Kathy, because I don't remember us telling somebody that they couldn't do that.
They just dropped it.
Okay. If you know somebody that's willing to do that, she'd like to talk to you.
I nominate Terry Woodwick.
I second that. I'm not a voting member, but I second. So yeah, I know that Kathy has pieced together that program for a long time, to be able to operate, and so that was, and being full staffed here lately at the minimum was, super important. 418 then is just a vehicle trust fund, like we talked before. I think over the years, at the end of our budget cycle and the start like we're doing now, there had been like a carryover here and there based on how things went the previous year. I know that there were times when I'd asked for $5,000 to be carried over from our previous year to the next year. But I think through the sale of vehicles and all of that kind of stuff, and the vehicles continuing to run for a little bit longer time, we got some newer vehicles that has built up a little bit. 422 is elder abuse grant. That is money that we use for adult protection services and the investigation and mitigation of exploitation, abuse with our older population. Those are all mandated services in adult services. 423, family caregivers. Always We get, about $11,000 in state granting to do like supportive home cares, and so we contract with Barb over there at Nicolay, and the staff works, and they employ the folks, and we are just self-sufficient. There's no levy in there. The 11,000 is broke out into, I believe, 2-hour increments throughout the year. I don't have an exact number how many people are served, but it's a fair amount.
Actually, that's down because staff works can't get any employees. We have people waiting for services that they don't have anybody to go in and give them services because they don't have any employee. So our numbers are down. There's probably 5 or 6 this year. Maybe 7, yeah.
424 is disease prevention and health promotion. Just as it says, we have very little pot of money there from the state. It's a public health function. And so, one of the nurses, actually,
This is Kathy. This is Kathy. Kathy
I'm sorry.
Oliver.
Yeah.
Yeah.
Yeah, I'm sorry, this is in the ADRC senior services. I think as you can see, there's not very, we don't have anything going in there other than, some supplies, like stepping on and those kinds of services, I believe. 425 was the jail meals. 440 is public health. Those are all mandated services. Again, disease prevention, communicable disease, human health hazard, full agent generates a majority of their income for that cost. And then all the wages and those kinds of things. 445 is our WIC program, women, infants, and children. A lot of prevention, resource types of services being provided there. If you're a part of the Human Services Board, you'll see things like a lot about nutrition. There's a breastfeeding peer counselor available for folks for support. Lots of things within that program. Lead testing, awareness, mitigation, all those types of things involved. 446 is reproductive health, and reproductive health related, all related, birth control, mitigation, communicable disease, STI testing, a lot of education, a lot of awareness. Prenatal care, I think that's 450 is that's really went down. There's not a lot. Those of us that have been around for a long time, this used to be a pretty robust program. There's not a lot. As you can see, there's not a lot of money that comes in there. 451 is the opioid money, the opioid settlement allocations. At this point in time, there's just a little over $100,000 in there. We're deciding what to do with those allocations. 452 is immunization.
So in, for 451, we don't have any plans for doing anything with that in 2025, but currently we don't have something we're looking at, program or anything.
So we've had a ton of meetings with pockets of people. I have tried to spearhead some conversation with our local therapists, with our law enforcement, with other community groups to say, hey, what is the preference? What would we like to do with that money that's gonna be the best bang for the buck? Everybody agrees it's prevention. We've had a lot of conversation lately about prevention specialists and doing a lot of primary prevention work in our schoolhouses, things around AODA prevention and education and awareness. We've had some difficulty with trying to get into the schoolhouses to have a curriculum. We do some Project Alert right now with our substance abuse block grant allocations. But I think we're kind of leaning towards kind of a school resource officer type of, type of proposal, is to take a look at, can that person be, do some primary prevention in the schoolhouses, can they help, mitigate, different activities like vaping and all those other things that are becoming super prevalent in our schoolhouses. Again, education and awareness, so hopefully deeper in at an issue. I don't think we're sold on any one plan yet, because I was big on prevention specialists. I've seen what other folks have done with modern life skills and age appropriate curriculum. And then when you sit in the room with the school teachers and the principals, they're like, I don't know if that's gonna have the best impact. And so, you gotta listen to what they say too, because they're seeing that population every day. And so, yeah, they talk about vaping is like super strong right now, very, very concerning. So, we're not sure, but we have this allocation, we have our OWI surcharge allocation, we have our annual substance abuse block grant money. There's a fair amount of money there that we could get something going, but I want it to be sustainable. And as I'm sitting here asking you for a $1.4 million human services budget, long-term sustainability would have to include putting some funds in there, potentially levy funds in a program down the road. And so I just don't wanna start something and then just to stop it.
Yeah, and I get, you gotta figure out where your highest impact is as well.
Prevention is where it's at, and it's what program is going to have the greatest impact on your youngest, earliest intervention, and then create sustainability. And then if, longer term, you hope to divert any deeper end service, this sounds super cliche, all deeper end service, you're just trying to prevent and promote, wellness through like community health planning and all those types of things. It all fits together from a human services standpoint. Let's see where we're at here. 52, immunization. We do a fair amount of immunizations. We have the children's vaccine program, right? Children's vaccine program. We get vaccine from the state and get out and create awareness and those kinds of things with families. We do a fair amount of, maybe not so much anymore, but Hep B, Hep C, all that kind of stuff. We have vaccine available. We do flu shot every year for employees, all those kinds of things. Good stuff. Birth to 3. So a couple years ago, we had a shift in birth to 3. We had a current employee that had a split position that was the birth to 3 coordinator and children's long-term support. And so because of the sheer volume of what was happening in birth to 3, we shifted that to, we contract with Sarah Siegler, and she's also our special education teacher. She coordinates a team for birth to 3 therapies, deaf, hard of hearing, physical therapy, occupational therapy, speech, all those types of things, and coordinates that. So that's a mandated program as well. There's a humongous assessment, and I think we're serving about 20 kids right now on that program, birth to 3, give or take. She's had a serious influx in assessment, but the folks, the kiddos that are assessed either have another resource or have chosen not to participate in the program. Parents choose that. 458 is maternal child health. Got just a little bit of time going in that program. That we have a 75% match that's required in that program, so we really don't have any trouble meeting that with our nurse staff time. But again, all things around education awareness. 459 is preparedness, so we're part of the, if I say this right, check me on this, the Western Region Preparedness Coalition, I think. It's got a huge long acronym, but we're part of the Western Region that the 18 counties that participate in public health preparedness. So you can see that we have about a $27,000 grant that we get. so that's levy neutral. And so our reproductive health person, our reproductive health nurse, splits time with preparedness. Childcare, you can see that,
That's just our contracted person. We contract that out.
for, through ES, right?
Yes, behavioral, that place, that family resource.
Oh, okay, okay.
Yeah,
We don't, this again is levy, so there used to be a fair amount of childcare in our county, and obviously that's went the other way, and there's a lack of childcare, but we contract with a facility to do administration and education and certification. Economic support, so we have 3 economic support workers, a supervisor, and then we have a separate budget for what's called a Medicaid enhanced position. And so this portion is the 3 workers and the supervisor. We're a part of the Northern Income Maintenance Consortium. This is a mandated service. This is Badger Care Food Share, eligibility, child care assistance, the whole works is contained in this department. Short story, the Medicaid enhanced position was used as kind of an attrition position. We had 2 folks that were here for 30 plus years that were on the cusp of retiring, and so we kind of started bringing this position in so they could train. And then those 2 people have now left, and over time, we've had different people in this Medicaid enhanced position that then move into a county slot. But that Medicaid enhanced position is paid for 100% through the consortium. The services within here too are like elderly, blind, disabled, family care team, there's a bunch of different teams that they do, and then the call center is the primary portion of this where they process applications for food share and medical assistance. Services, I talked about this is the adult services, this is our mandated programs of our 5142 board. And so 5142 spells out that we have the responsibility for disability, mental health, and alcohol and drug responsibilities. And so that's again our community support program. And all of that serious persistent mental illness and placements and emergency detention and all of those types of services. This is a big budget. We get a fair amount of revenue within here. This is our substance abuse block grant allocations. This is our community mental health. This is our mental health block grant. Fair amount of stuff in there. But when you have placements that are very expensive, we generally have a $200,000 fund balance that is, not fund balance, contingency that is available to offset. We've just experienced some placements this year that have driven that up a little bit.
Yes, okay, so there was one, I think, was it Ruth the 3? They missed putting in the transfer from the general fund, so when we do year-end budget transfers for all these funds, all of these budgets, they all close into that 255.4, which is that services budget. And so, on the tab for Ruth the 3, when they submitted their budget request, it wasn't in balance, so it was like $106,000. So we just put it into the proposed by finance, and so that's why, because it has to be balanced out. But then historically in that services budget, we haven't actually put levy into that, but because we have such high placements, we have to put money directly into that budget. There's always been levy into HHS in general, but there's going to have to be a lot more for 2025. So, yeah, they all kind of pool into that 255.4 at year end when we do like, oh, there's excess levy in this budget, we need more levy in this one, so they all kind of wash out in that 255.4 and do a transfer between the general fund.
I had a question too. Okay, so under revenues, why does Winnebago show as a
explain that.
Lord knows the answer.
Yeah, Winnebago.
Why does Winnebago show as a negative under revenues?
Because Winnebago, when we send people to Winnebago, which is way more expensive than any of the places he mentioned, what happened, you know, it was always a mystery to me over the years, so I finally found a lady in Madison that could tell me what's going on. It's actually very simple. What happens is when any county that sends a resident to client to Winnebago, it can be $900 and some dollars a day, it can be over $1,300. And what was happening was the counties were not paying their bills. So what Madison does is they pay Winnebago, and then when they settle our gears report, they just yank that money out of any money that we have coming to us. And so it comes in as a negative on my revenue report.
Sure.
And in January, we got no money because the January report's always a little smaller, and we had a really expensive client down there that they didn't even have enough money of our January revenue that they went back in and dipped out of my final from 23, which I had to tell Jamie, make sure that revenue stays in 23, because that's where it belongs, put the whole deficit in 24. But that's in essence, that's what it is. So now I can turn around when I do the state report every month, and I can report that negative against our basic county allocation. So we're actually going to see, I think in years past, maybe that was kind of a gray area, and I'm not sure, there might have been some funds left on the table, and we didn't have a lot of expense, usually, could be 15 up to 30,000. The last 2 years, it's been really high, and that's why it's a negative.
Okay.
To answer your question, is because it comes in as a negative on my revenue report.
Okay, thank you.
Yeah, but we should see now, because I reported a month ago or whatever, I reported my total. We do get some of that money back because any client that's there that has any kind of, insurance or,
Medicaid or Medicare.
yeah.
There's eligible criteria.
We
If you
were
meet
up-
the criteria, insurance will pay.
We were up to 170,000, but we've gotten about 69 of it back. So, I mean, and it doesn't actually come to us. It goes to Winnebago, and then Winnebago just sends a credit to Madison, and then Madison will show a credit on my revenue report. We don't, so, but that's in essence what it is. Madison pays Winnebago, and they just take it away from us every month that we have money coming. So,
Thank you.
Question on your adult services, community, mental health. In 2023 it was 236, the budget for 2024 is 225, and this year it's more than doubled to 540. Why the big?
Terry, which line are you on?
It's 53,516,
Line 20?
line 20. Why is it more than doubled your budget for this year?
Yep, super good. So the placements, the residency finding was made for our county to be responsible for a person that was $650 a day. And so that's a little over 20,000 a month. We didn't have that before. And then we have our community support program, which is our adult mental health. And then Trumbull County Healthcare Center is $375 a day. All of those placements go into that number. And so that's why we spent a lot of time talking about what number to put in there for 2025, because not only do we know what we have now and what we project is going to be still there in 2025, but there's a little unknown as well. And so we tried not to fluff a number. That's a relatively hard number relating to what we know we have right now for placements and cost.
It's more than double 2024 plus 100,000, so, yeah.
And that's just based on what you know we'll have for sure, so we could.
That can
It could
continue on.
go way up if we got
Got another one.
5, 6.
It could also go way down.
Yeah.
But you're right, is that the Trumbull County healthcare placement, like I said, I made note that in 2016, this was the same person, okay? And as a result, we think that this person will transition out of there, okay, and into something way lesser restrictive, because it's relatively a pattern. And so, Chris and her squad are working really hard on the person that we had a residency finding on, to get that person in a lesser restrictive environment there as well. And so, we think those things will happen, and so again, we had to put a number in there, so, but it's costly. We also built in there a little bit, is that the provider that we have for our community support program is going to change how they're gonna increase their rates, is what's happening, and so, we had to build that in there as well. Let's see where I wrote right there. Yeah, all community-based residential facilities. Again, total, we have 5 folks that are in placement that are in that line. Terry, for your question, ranging from 150 a day to 650 a day is the most expensive. 464 is Wisconsin Works, that's a W-2 program. Through the Northern Income Maintenance Consortium, we get incentives from the state. We send that off to Wood County for investigative measures in reference to fraud and those kinds of things within the programs. Community intervention, that's a youth justice program where we never really know what we're gonna get in 466. We just got notice that it's about $2,600, $2,800. How much was that?
We're giving 25.
Yeah.
I'm not sure, it was 8 for last year, I don't know.
Yeah, I think it might be like $5,000. What we do with that is we talk about the Rusk Restorative Youth Program, to help them offset the cost of, Mr. Gauger and his program as best we can. And then anything we've got going in youth justice, 5228. And so, yeah, there's,
It's based off of the people or the juveniles that we had in like high placement, so.
super good. So we try to use that money to help us to offset those community-based programs, community intervention programs. 467 is our energy assistance program. Again, we try to keep that to levy neutral. This is the folks that are eligible for heating assistance and the administration associated with that program. 468. So we talk about this every year. This is something that I highlighted on my sheet, is temporary assistance. We are not 100% certain why there is a levy balance or a fund balance there. We're not exactly sure where that money generated from, but it's been sitting there for a fair amount of time. We think it used to be economic support driven, potentially.
Well, Irene administrated it, but we don't know where the original funding came. I don't know, it was before my time. So it's been many, many, many years. And we haven't done this program for a long time, and I'm not sure what determined that we quit doing it, but it was money that we loaned out to people that needed a car fix so they could go to work, or they needed help with their rent payment till they got their disability from the, confirmed with the government or whatever, and then they were supposed to pay it back. And some did, some never did get paid back, of course, but I don't know where the original money came from, way, way, way back when, and we probably haven't given money out for 10 years, I bet, pretty close, 8, 10 years, yeah, I don't know, so.
Maybe another source of funds.
Well, I'm sure there's restrictions on them,
Wherever the money came from to start with, I would think I don't know who's got the origin. Irene Lehman would probably know.
And I think what's happened in the meantime is you have things like Salvation Army, Harvest of Talents, FSET, some of those other workforce ready kinds of things that have come along that have resulted in not needing to use this money, that there's other monies available to do that. I don't know why we stopped using it, I don't remember using it.
Irene could probably answer our
Should
questions.
call it right now, we'll just put her on the spot.
Oh, I can call her.
Just teasing.
I'll call her aside
Yeah, I
from
know.
Could you even incorporate that into eating assistance or something where people can, you fund it, you let them use that as a loan type thing? I mean, if they didn't qualify for actual full assistance.
So we do a lot of, like, when I talk about like Harvest of Talents, that's where that Harvest of Talents, Salvation Army, those programs have come into account. I'll try to find out what the origin was, cause that could be general fund money potentially, I mean, seriously, if we're not gonna use it for that purpose, why is it sitting there? Let's do something with it. So, I'll find the origin, I'll get back to you on that.
Now we only gotta get 713,000.
So you're telling me there's a chance?
He's helpful when he wants to be, when you're tricky.
You reeled me in. Okay, so here's one, the intoxicated driver surcharge allocation. We get to keep 49%, I believe, 51% of the fees that are paid, the surcharge allocation. Someone gets an OWI in Rusk County, we get to keep a portion of that money. That money's been collecting for a long time because we do not contract with the WAID assessor. The WAID is the Wisconsin Assessment of the Impaired Driver, and that's a requirement when you get an OWI. What happens is that money has sat here and continued to build. That's what I was talking about before in conjunction with our opioid surcharge dollars. Taking a look at how we could do and use that for prevention and those kinds of things. The state of Wisconsin told me to stop calling when I asked them what the allowable uses are of that money. That is general purpose money for the county potentially. The only earmark that they have is if somebody is on a driver's safety plan and they have treatment needs and they don't have insurance or any other possible funding stream, okay, this money is supposed to be for that type of thing. In the last 10 years, I've used $2,300 of those allocations, total, because the person did not have, two people did not have insurance, and so we use that money for that. But I used to continue to call and ask them questions about the state of Wisconsin, Katie Bale, super nice lady, and she told me to stop calling, because really it can just be general purpose money, so 700.
On the 583, Phil.
So, but those are dollars that again, we've used like, actually we did use other dollars out of there. We used the primary prevention with the trailer and the impaired driving and those goggles and all that type of stuff. We used out of here for $10,000+ for that.
The sheriff's department needs to be writing more. Is that what I'm getting from this little fund?
That could be one takeaway.
We need to get Wallace in here and let him know that he's not contributing correctly.
People should choose to drive,
Yes.
sober.
By all means.
But yeah, this is something that is, as long as I have been around here, this fund balance has been growing.
Well, I think it's good to know about a couple of these things, to try and clean them up, find out the original stuff and if they can be.
Don't look at me, that's.
I want the original out and just clean up some of these things, because they've been saying it for 10,
Got a little
20
slush
years
fund
and
going
nothing's
on.
been
Call
done.
him out, Terry, call him out.
Get 'em?
All of a sudden, did you get on here? So, but something that I did say before, and I think I maybe made this comment in passing to Jamie a little bit, is theoretically, the $200,000 that you guys earmark for, that the county earmarks for kind of like a contingency for like adult services, this is a one-time allocation that is sitting here. If there was the ability to draw on those dollars if needed and qualified for the event, those are dollars that are there. Those are unencumbered dollars that are sitting there that I would prefer to hang on to, because I don't know when there's going to be, something that is OWI related or primary prevention or those kinds of things related. So I'll just leave it like that.
None of these high cost placements ever had any,
They're generally mental health cases, sorry. But we have done things like, ignition interlock. And so we had a person that, a barrier to their employment is they could not fund the full ignition interlock cost. And so they had to do, all of the other things associated with the ignition interlock. We did the install. And so it was like $125 each, cause they had 2 vehicles that the DMV said that they had to install. So we did $250, and they had to pay the rest of the monthly cost, the calibration cost, so on and so forth, for those types of activities, so they could go to work and make a living and make their child support payments and all those cost of living things. All right, 471 is our youth aids budget. That's associated with Ashley's department for youth that break the law and are involved in GIPs and status offenses like truancy and those kinds of things. 472 is our case management. This is a pass-through. So currently with our relationship with our community support program, they bill Medicaid for all of the allowable services, and thus that's under our NPI number.
National Provider Identification.
Under our NPI, we receive that money back and then we pass that through to them for their cost.
Jeremy?
Yeah.
You skipped 470.
470, what is it? Donations. Oh, boy. Okay, how did I skip over that? So, Laura, that's in relation to meals.
No, this is like Ashley has,
Oh, yeah.
Ashley has, Eric's got the lion's share of this.
Okay. You can see that that's vets are in there, and then there's again, some foster care, ADRC, and then there's a fund balance, which is broken out by department.
I don't have it.
What do you do? It froze up. Oh, there it goes.
Got it flustered.
Yeah.
First time ever.
I don't know.
People
So
pay
that-
for Christmas meal for the ADRC, some of that are those programs.
Community donations towards those programs, vets, meals, foster care, those kinds of things. Mr. Meyer was enjoying that, maybe you froze up for a minute.
You skipped it, and I figured you were scared I was gonna deduct it off the levy.
Another 28,000, but you're gonna have to fight with, you're gonna have to arm wrestle vets and Ashley's pretty rough.
No,
So,
just teasing.
let's see, 472 then was the case management pass-through that I talked about. That's associated with our community support program. That's reimbursement through Medicaid eligible cost. 473 is our comprehensive community services. This is a big one. Comprehensive community services is a 100% funded Medicaid program that serves our mental health and AODA population. And so currently we have 61 to 65 folks that are participating in that program in their own identified recovery program. Super good. We have currently we have four service facilitators that are case managing that population. Very good initiative there. We brought that on in 2015 in December. 474, I talked about children and family services. Again, a whole bunch of mandated services there that Ashley and her squad are very good at. Aging Disability Resource Center. This is again everything ADRC. These are the things that are not associated with the senior center types of things. This is all your information and assistance for eligibility for the managed care programs. This is your disability benefit specialist. This is your elder benefit specialist. Kathy as the ADRC director. And all of the programming that comes along with them.
But again, on this one, if you look at 114, line 14, again, the salary's more than doubled, from 24 to 20.
Is that that
So,
What is that?
two things. I'd like to thank you for the wage adjustment in July. That made a big deal of difference for all 50 of our employees that we have in human services. That's a little bit in there, but then also there was a second INA position, information and assistance position, that unfortunately has not been filled yet. But that's why that doubled. On my copy here, 2 INAs, a disability benefits specialist, an elder benefits specialist, and the supervisor. But that line specific is the INA specialist. There's a second one in there. And so we received some extra funding that I came to finance, and I looked Mr. Undershoots right in the eyeballs and said, based on funding and all those types of things, these are gonna be, that will theoretically help this budget, but more importantly, it's gonna help our population access services.
Well, line 22, Jeremy, that one really increased.
22, unemployment compensation?
No, substitute care I'm looking at. Am I on the right one?
No.
Ahead of me yet? I'm in 74 yet.
Oh, you're on 474?
Yeah.
Substitute care,
Yeah,
that's what
substitute care.
care.
Yeah, so,
That one jumped from like 330 to 500, but I don't want to jump around that.
no, that's okay. This is, I think it's actually line 23 is, oh, we might not be the same one, yeah. So that is our lab lake, that is our residential care, those are our placements through children and family.
Okay.
Extensive placements, least restrictive, safety services. So, did you just say kinship? Did you just say kinship care?
Yeah, I said that jumped quite a bit too.
Okay, so something interesting with kinship care is that, a fair amount of years ago, the state wanted us to report all cases that we have in kinship care, even if it was outside what they fund, okay, for the sum amount of money that they give us. And so we continue to report, and generally speaking, every year, they re-obligate money to us to cover that cost. And so if another county doesn't use their whole allocation, they'll send to counties that use more than their allocation. And so again, it's an initiative where somebody kin related is taking care of a child and they qualify for that payment, that monthly payment. That's a good one. 476 is the Medicaid Enhanced that I talked about before. That is 100% funded by the Northern Income Maintenance Consortium for one worker in Rusk County, and you can see that cost. 477 is children's long-term support. So as much as we're again continuing to talk about funding and those kinds of things, we have like 100 children in Rusk County that are being served under the Children's Long-Term Support Program. It's either a physical disability, mental disability, and as a result, we have two full-time workers here that are carrying a caseload of 50 each. And so through case management and Medicaid reimbursement, I likely will be coming back to talk about another worker, just because of sheer capacity there to take on those cases. But this again is a program that we received WIMCR cost settlement, and then also the reimbursement that you can see down in the revenue that makes us levy neutral as well. That's good. Those are all mandated services. Veteran Service Officer 480, we talked about that budget already. If there's any advocacy at the state level for a little increase in funding for our veteran population, that would be a great opportunity. The Veteran Service Commission, we do, we have a fund balance there. Tammy Stoker now has a 3-person commission that if there's needs that, anyone veteran has that qualifies, they have some money there that they can assist with supporting them. And then child support is our last, or I'm sorry, not our last one, our 490. Child support is, for years and years and years, child support has met their benchmarks for incentive funding through the state, and so that's been very good. There is a levy there. I believe we have.
Well, they only pay, what, 66%.
66% reimbursement on that case.
We have a small portion that's 100 and then, yeah, we got a 40, we got a 30.
34%,
Yeah.
So there's levy there.
Question, going back to 482, I mean, there's nothing, why is there a levy shown when it's got a fund balance and it's got stuff out of it?
No troubles, I can answer that. But both of my predecessors suggested that every year we should ask for $500 into that commission balance and to help support our veteran population for those additional needs. That's why that's in there. We've continued.
I was just wondering because, you know, if you got a fund balance, why you're levying for it.
Yep, great question, great question. That is one that we've asked every year, because I know that Tammy and previously Eric and Mr. Mosier and Bob Stone before that, they have used that fund balance. Yeah, I can't remember when it happened, but I think Gary had it. Yeah, usually that fund balance is down, but that's a pretty robust amount of money, still 14,000. Good question though, Mr. Weber, thank you. 492 is the coordinated services team, so embedded within Ashley's department, we have a staff person that is doing coordinated services. This is a state initiative, a fair amount of years ago, there's $60,000 that come in, and we utilize that money to offset the cost of that position. In 2020, we brought this position in-house. We used to contract that $60,000 out. We brought it in-house to have that person be a part of our team. And so that is a wraparound service initiative for families, kids and families. And so the function there is a lot like CCS. It's a wraparound kind of program to take a look at a holistic approach of needs that family may have. And so that again is levy neutral. We just use that to offset the cost of that position within children and families. And 441, I think in 2018, home health care went away. And so that was all zeros. Unfortunately, that was a good program, but unfortunately it went away. So.
Question.
Yeah.
You've got a lot of accounts here. Some of them, at least on my screen, show up as green, a couple of them as yellow. Would it be possible to color code the bottom ones to say whether they're levy neutral or that require levy? Or that
Our
are
color
zero?
coding is based on like they're green if we don't really need to look at them again, they're yellow if we need to revisit them for a budget purpose.
Okay, because I think it'd be a lot easier if they're color coded, you know, that there's no
But
levy.
you can look at this to see
So I
what's
do have
levy and what's not.
there is a, maybe to answer that a little bit, if you go back to the summary page, on the bottom there, I think it's the second tab. That'll give you a little bit of a breakdown on what's levy and what's not. They're kind of lumped a little bit, but you can see what is levy. It doesn't.
It'd be a lot easier just to look at these than the ones that are a certain color, you know, are a levy, so you gotta pay attention to that, otherwise you don't.
available almost any time if you wanna shake up, you can see the operation, we can talk about this more in depth. If you have specific questions, more than willing to talk through those numbers.
If we have to make any cuts, where would you like us to go?
Yeah.
So it's interesting that you say that, because honestly, Mr. Meyer, honestly, we were just, Ashley and I were having this discussion, is that, if we were asked to cut, the difficult take is, we just created an INA position. And we do have additional money that came in through state granting. And so, if you asked me to cut, I would have to cut that position. If you asked me to do a second cut, it would be very difficult for me to, position-wise, and this is a really good conversation, because we're pretty bare bones in every department. There's not a lot extra, like I say, CLTS, they have 2 workers coordinating 100 kids and their families, okay? And so again, there's a funding stream for that. But if you ask me to cut 65,000 or 70,000 by 75,000, it's right there. INA, we just created that position.
But that's
We're-
not levy, right?
What's that?
That's not 65, 70,000 of levy.
Well, there is, if you look at that budget, and again, this is pretty timely, because we're recruiting right now for this position, is that, let me go back to, was it 469? Let me get to that budget quick here.
Which one is that again? 460?
It's higher than that, 474, 475. That was that line that Mr. Wedrick asked about, it's considerably up, line, on my page, it's line 14. We received an extra $76,000 in state allocation. And as a result, we went through the process for a second information and assistant position. And you can see that our levy ask for 2025 is 62,500, or 62,300. So again, if I had to, real-time discussion, if I had to have that kind of discussion, that's where I'd have to start, because that's our newest position. That position was filled for 1 month, and that person left, and so we're right now in the middle of having a discussion about offering that position out. We just had interviews last Friday. But again, if you're asking me to cut some money, I would have to start there. Because everything after that would be a tough conversation. You can reduce my salary to help fund the position. But yeah, that's the real ask. Or the real answer to the I think trying to think if there was. Yeah, what else did we say? That was kind of our conversation, right? I even talked to Kathy about it. What's that?
The delivered meals, if we had to redo that.
Yeah. So, if, the other initiative that's gonna happen regardless is in the 418 budget, I'm sorry, I keep saying 417, is the home delivered meals program. We are going to make some decisions there, because we just cannot keep, admitting everyone that is eligible for a home delivered meal. That's a tough way to say things, because there's more than just a meal that happens there. The drivers make personal connection. That might be that person's only human contact that day. There's a whole bunch of things that come along there, but that is not a mandated service. And when you look at that screen and you got $201,000 in levy that we're asking for, we're gonna have to create some kind of cap there. But Kathy and I are gonna get in a room and close the door and the shades, and we're gonna figure it out. We're gonna have to figure out what we're gonna do there. It starts with eligibility, it starts with, maybe a little more real look at what makes you eligible for a home delivered meal. So, I
Well,
shake,
that's true, because, like you say, we were all volunteers, we didn't get paid for mileage, we didn't get paid for our time. But there was this one lady who knew my folks, she was 107, and if you thought I was gonna drop off a meal and get out of there in under a half an hour, you're mistaken. Yep, like you said, it's
100%.
loneliness, talk about stuff in there.
Personal connections, yeah.
Yep, yep, so I knew very well it was gonna take half an hour to deliver that meal.
The last thing I'll kind of say is, I guess, regionally, the discussion this time of year is always levy ask and programming and, what do you want to, what are your initiatives for the next year, and what are you going to try to accomplish, and what ways can you better do things and that kind of stuff. And if you look at counties that are our size and you match up our levy ask with their levy ask with 7 programs, we are way under. We are way under. The folks like Ashley and her folks doing children and family services, it's easy to put kids in care. It's hard, it's very difficult to do least restrictive and have those kids stay in the community with resources and creating sustainability versus dependency and all of those things that come along with education and awareness. So hats off both adult services and children and family, along with the other 5 departments that keep our levy in this neck of the woods. So thanks for having me. Thanks for having us. The real stars of the show are these 2. And if you have any questions, don't hesitate to call me back down or pay a visit. Maybe not as a group, can you pay a visit? Because then I'll get scared. But you're more than welcome to come and chat me out.
Okay, thank you, Jeremy.
Thank you. You mind if I pester you with that contract if I come back down? Thank you.
Jeremy,
Thank
I
you.
talked to Brenda Jones.
Did you? Thank you very much.
Yeah, Jeremy, bring that back down whenever you get there.
Okay, super good. That's an APS budget, ADRC.
Oh. We'll see what happens.
Sounds good. Thank you for your time, okay? Thank you.
That flows in here.
I'm just gonna get a little close because I don't see very well. So, does anyone have any questions? It's pretty basic. Slim. I think the main changes were, I raised the autopsy, the amount of autopsies for the next year. We've had just so many unusual cases this year, and so I just wanna make sure, I'd rather have a little bit more money in there than, go over. And then we switched around the, cremation fees. Instead of, expecting $7,500, we put it to $6,000. We really haven't had as many deaths in the.
Still less than 7,500 here in mine.
Okay, wait. Oh, you know what? I changed it for my committee and then I never sent it to you, did I?
Okay. Oh, okay.
Yep, that's my fault. And of course, that's on my computer. So that would, the only change would be that to 6,000. And then up in the autopsies, I think the 17,600 is for 6 autopsies. And I raised it to 8 autopsies, so what would that be? If we took 17,600 divided by 6.
$2,933, sorry.
229.33, then it would probably go up to, darn it, that's my fault, I'm so sorry, everyone.
3, 4, 6, and 7.
That sounds about right. Cause I know it was 2,000.
3, 4, 6, and 7. You said divided by 6 times 8.
Oh, higher, that's the times eight.
Yeah.
Exact or 23.5? So 23, 4, 6, and 7.
Yeah, they vary a little bit, so 23.5 is good. So I increased that to 8 instead of like 1 every other month, but, that's pretty much the only two changes I made. Trying to think if I don't think I changed anything else. That still seems kinda high. Is your budget really long? Do you want me to go back and get my computer? Or do you guys wanna just kinda go through this? Okay. If anything, I would have taken a little bit of money off of one of my investigative supplies, but I don't think I did. Terry, you wouldn't be able to pull up the packet from our meeting?
Services, August 14th.
My budget. Can you plug it into the screen?
Well, we've got it.
Oh, you got it here?
Yeah, we're just. Which month?
August 14th. It would be the packet.
Page
It
12.
is.
Page 12 of the packet.
That's the budget projection for this year.
No, there's another one. My budget is in
It's not
there.
in there. It's not in there.
I'll take a chip.
Just to send.
We want-
Chip.
Cause I had the projection, then I had the budget.
We have a long ways to go.
Human service complete.
Well, you guys have
Well, it's so long, you get hungry.
Yeah, and not that your 2025 budget projection was not in there.
I have it out in the car. I'll be right out and get it, make sure everything's the same.
I mean, it's whatever you want.
Yeah, I'll do it, just so we have it straight. No.
Going out to get something. Well, you lost control of me again. Yeah, you lost control. You got distracted for a second, boom, gone. I'm just a vice, don't be asking me to pick up your weights all the time.
Yeah,
I can't do it, I got bad back.
So relieved, you know, everything.
85 on that.
Was not a number that was in this, so that's
Yeah, I forgot.
Really went through.
So they check.
I know. I know.
for a good budget, it's way down from what it used to be. When she took over, it was way down.
My budget,
It was,
it's a number,
I think, and they asked for, in 2023, 143,000. And I can't remember what my budget ended up being last year, but.
2024 appropriation column.
22,326.
71.
I'll probably check.
So I kinda just adjusted a little bit to
Thanks.
be on the safe side for the autopsies, that's really the only thing that. No, I didn't find it either, so sorry. Miranda had it up for me, that's why, 'cause I sent it to her. So I don't know if you have any questions about what's on there.
Well, we'll be going over this again.
Okay.
I suggest you touch it up and get it done. Jamie, right, Jamie? Then we
I can send it to you right away.
This is close enough, I mean, you're.
It's gonna be
that you're
under.
making-
Whatever's on there. But, if I send it to you within 5 minutes, you guys look at it, if you have any questions, just give me a buzz on my cell phone.
Okay, yeah, and or we'll touch on it again next week or.
Yeah, I'm so sorry that I didn't send it to you for our meeting. Okay, thank you, sorry about that.
It had to be Vernon, but we just thought she came in here to say hi.
Well, I was here Thursday, but nobody else was.
Another hour and 10 minutes, another
I
hour.
wondered when you said, "Oh, I got back," and it was like, wait a minute.
Those dirty buggers you brought on with.
Well, I know I had to make sure I got you guys a day in advance, so. Way ahead of myself.
Alright, this is your main operating budget. An overview of that.
There's no changes. I don't know the computer support, we're still on the old system. We won't upgrade until next year, the new system, so probably be really close to that same amount.
Because of the investment income. And that's budgeting to be conservatively for that investment income.
Well, I hate to.
It's hard to predict.
I know, but you never know, especially like with the election, you don't know.
Like, I think we had budgeted 250,000 or even 100,000 for 2023 and we hit 1.2 million. I think we were $1 million over, it must have been 200,000. We were
Yeah,
$1 million over budget
Yeah.
for 2023 for investment income.
And it still looks good, but we are down a lot of money from last year.
But you have a lot of it in CDs too. Well, but the ADM we do record monthly.
On some of them aren't, but most everything comes due in 2025.
Like the CDs that we hold directly with our banks, most of those we just record that interest annually at year end. When we get the 1099 interest statements, so that way we can verify it. So, the 6 month isn't really a true 6 month, if that makes sense.
Right.
You just renewed a couple in July, didn't you? There were a couple that were, I know that's not on this, but I didn't see where that went to next time around on that.
They were either just rolled to a better interest rate. One of them was CDs just transferred into a money market, cause our money market was following the pool, which is the highest that we have.
I bet that's what it was,
Yeah,
because
but-
I couldn't see a new expiration date on anything that
Yeah,
was
those money
past.
markets don't, so.
Okay.
Yeah, right. Yeah. Well, right now, there's not a whole lot to invest, so, I mean, we just paid our August settlements today, cause they're due tomorrow. Like, almost 5.3 million, so. Now we don't make much money through the end of the year, so. Supplies might go up a little bit for next year, I mean, we've been staying under pretty good, but you know, with the new treasurer coming, there'll be envelopes, you know, more extra stuff that might get thrown into that. But still just stay the same.
That depends on whether you go hog wild or not.
I'm not, let her do it either.
Ready to go to the next one? It's all pretty much the same as what it was last year.
The shared taxes and office released, is it later this month or is it next month?
September 15th, and that usually gets put out on the, DOR website, but I think Connie gets the actual hard copy.
The letter, yeah.
So, yeah. And we got a big increase last year,
Yeah, it's
we
not
won't
going to be
have
as
that.
big, I imagine it's going to go up, but not
Yeah,
enough to solve all of our budget problems.
Yeah. So I think it's like 700,000 more last year.
Everybody reading through this, got any questions?
Yeah.
49 cents?
Oh, the 39. Oh, I know that fills in automatically. I don't know. Oh, it might have been printing or something.
I might have been, yeah. Oh, I think I need to make a change on that too. There is, for next year, they're getting rid of personal property. So the 29,645, that one should be, should raise to 77,283.
So then that's going to come out of our.
Right.
Okay, so then, it still doesn't change our bottom
No,
line.
it doesn't.
I just have to make adjustments through. And then tax deed. So for the tax deed, I think we have a levy going into that for 2025. When, in the past, we've been able to kind of have revenue. But we can't make a profit off of these anymore. But it could end up costing us because we could have costs going out, but we're not selling that property right now, or we don't end up recovering all of our costs through the sale of that, so there is some.
Yeah, you can't make it up on the next sale.
free to run.
Wait. Do you guys have questions for Verna on her treasurer's report or any of that? Do you wanna go over that now while she's here?
I was just gonna ask, as far as tax deeds, now that the end of July rolled around, how many properties are at that 3 year where you're,
Oh, there's a ton right now, there's probably right under 200.
oh,
We start out big.
Oh, man.
By the time December rolls around, it's been like maybe 30, between 30 and 40.
okay, okay.
We just took 2 tax deeds, the one that,
Yep,
the
there's
5-year.
that one,
I'll contact her, she'll make a payment, but I have to keep on her.
oh, that was that Jack and Bruce, right?
Yeah,
So
but,
she has been making payments?
when I contact her, I'm like, don't forget to make a payment, so then she will.
Really? Okay.
We did take 2 tax deeds, I don't know if we're gonna sell them, because there's another act out there, where last year we had Act 216 where, we had to get the proceeds, pay off liens and stuff, now there's Act 207, which is, we have to pay the property owner. We also, I think, have to, when we first, put it out for bids, it has to be like a fair market value or assessed value, I think. I'm not get together with Rich and find out what a lot of the different counties are kinda hanging on to them, not really knowing again what to do with these, so.
Yeah, wasn't there just something recently that came out from WCA and that?
Yep, there was
That's what you're talking about, right?
last Wednesday, I think there was I watched a webinar.
Meeting or something?
Yeah, so,
But you didn't learn anything from that either?
well, I made sure that Rich was gonna watch it, oh yeah, I'm on it, and then he didn't watch it. So, but he's got it, I mean, it's out there to watch, so I mean, he's gotta direct me on what we should do. And we also have to get like a resolution to, offer it back to the property owner again, so there has to be something in place with that. And I think that's only if they're, living in the home, so if it's land, I don't think you have to, but it's not clear. That's just another thing, again, these acts aren't clear enough to know what you're supposed to do. And then they always state, well, asking for counsel,
Well, we'll find out, cause it's not really advantageous for us to hold on to properties either, if we get them back out on tax roll.
And hopefully they go to someone that pays their taxes.
Right. Right. 50/50.
So the treasurer's report is up on the screen if you guys.
Also, I saw Bernie, you had like, for 23, there was like, I think it was 23, over 900 unpaid so far. Was it 23? You sent out that 2 in your
Oh,
packet.
the other, the taxes report.
I thought there was over 900 for like 23.
there's a little more due
There
there,
we go.
yeah.
Is that normal?
For the 2023, yeah, that's pretty normal, that's a little bit higher than what it has been. For the 2023, the tax that we just collected, it's about, I thought it was a lot higher, it's really only about 25,000 higher than last year. Then when I send out the certificates, September, 1st of September, then you get the people who thought they paid or thought their escrow paid, so we'll, get some of that back, but it's a little higher than it's ever,
900 some?
Hmm?
900 some? Cause like the not received 831 for last year was 420,000, year before 474, 466, 559. So obviously, we'll have some more posted, but.
yeah.
Yeah, so we'd be looking at the 23, yeah.
Almost 553.
Yeah, so that's.
Oh,
The
So-
this is
so
that
that
back taxes
553
report.
would be this
Would be,
number.
yeah, the number that
If
we're
it
gonna
was
insert in there
updated.
once we do that.
Okay.
Um,
So it is about 100,000 higher.
but back in 2016, it was 841,000. 17 was 701,000. I'm just looking at the
Yeah,
taxes
yeah.
report that I get them. And you have to keep in mind too that our tax levy was higher in 2024, or the 2023 levy collectible in 2024 than the 2022 levy collectible in 2023, because we did apply for the 2022 levy collectible in 2023, we applied some of that Owens Corning Conway proceeds against what we levied for debt service, so our, the amount that was levied on the taxpayers was higher.
So what is actually listed, when I sent this out on last Wednesday, I had to drop down the general, transferred that 5 million from the pool into the general account, and then we spent that today. So it's 5 million less.
Just about 8. That's all. Means we've done 10 for the year.
Spend money like crazy.
Yeah, I mean, I did it too, that transfer could have been in the 2023 numbers.
Oh, sure. Yeah.
But yeah, we didn't borrow any money, we haven't borrowed any money since 21. Yes. So, we did spend down some of that.
Well, and of course, the ARPA money was spent, the wind down was spent.
Yeah, and if you scroll down to the bottom of the CDs, is there more in CDs now than there was?
There's a little bit more, yeah. I think there's 15 million in CDs, or invested that way. Thanks.
We're gonna do the county clerk and the county board budgets. You not ready?
Board of Adjustments. Oh, I kinda just left things the way they are there. Cause you really don't know, like, legal fees are they went up quite a bit this last year, but, I mean, typically they're not. So we just kinda left them the way they are, unless you guys went up the legal counsel, we can do that. What do you think? I mean,
It's hard to predict what's gonna happen, I mean,
it is.
we recover our costs here, we get reimbursed for those legal fees, so. I guess the downside to leaving it where it's at, if we do go over that, we just have to include it in our budget amendments, but
Right.
we're gonna have some of those regardless, so.
So we're going over a little bit on our target. So you want me to take something down there, I certainly will.
mean, we charge it, there's a flat fee that they pay, but then they also have to pay if they have to bring another council.
Right.
So, I mean, it kinda is what it is.
Right.
Unless we
Hard to
change the
predict.
fees.
It's hard to predict.
Yeah.
Alright. So. Jamie goes to the top part. The telephone, we're at 504, but we were told last year to up that because wasn't it getting done, you know, by the department?
Or, what you sorry, oh, the telephone.
Mhm.
Yeah, yeah.
Software, I did, that is, so there's 10, I didn't know if you wanted the 10,000, but I did change it, it's gone, I don't know where it went.
That's ARPA.
Okay, so you want that out of there,
Yeah.
okay. And then Civic Plus,
Right? Or no,
I thought we were budgeting it from there on out. So that's why I put it in there, I put the 13.5 in there.
I think we need to put 3,500 here because the 10,000 is in ARPA, that's.
Okay, okay. And then Civic Plus, I did do some work with them, we were having problems with them, putting stuff on our, ordinance page in a timely fashion. It was, so I negotiated some stuff with them, and my first check was $1,977.16, and for this, update for the Civic Plus, I can get them for the whole year for $2,255. It's a yearly contract, and they'll do this better work for that kind of money, and they'll give us credit for the 1977. So, I just need your approval on that, so that, so it'll make it easier for me too, that we can actually budget instead of guessing, because the next statement due besides the 1977 was $907. So it would keep, I mean, that's how much it costs for them to, do our ordinances on, you know, update for resolutions, that kind of stuff, so, I did negotiate with them a little bit, and I think I got a much better deal, so. Postage, we just keep it at 700, I haven't changed it, duplicating's pretty close. Office supplies at 2,500. I'm thinking Tracy's probably gonna need a new computer, I'm not sure, but this year I have to get a new one, mine's quite old. Dues are 150, that's for Wisconsin County Clerks Association, travel mileage, WCA, convention, that type of stuff. Seminars. Elections will go down and be cut basically in half, because we only have 2 elections next year. Right? So that takes that every other year we go up, then we go down. And then, Board of Canvas, those are the ladies that come in, do the Board of Canvas after the election. Retirement, so on and so forth. Board of Canvas mileage. There's the codification of records. Veterans grade, we have to pay anybody that's been in service. We pay every cemetery the money, so that's where that comes from. Any questions?
Evidently that all gets paid at the end of the year, cause I see nothing but for 6
Right.
months.
They'll just start submitting it to us and then we pay it. They actually, sometimes they submit it to the VA office and then they bring it down to us and then we pay it. Yep. So then there's income. So a lot of times, you know, if I got a grant, it's kinda hard, cause it's sometimes it's last minute, but cutting permits, that would be cutting permits for the county, not, like, it's not forestry, it's other. so reimbursement for election stuff from municipalities. So I anticipate this year we'll have municipal election, and then the school districts have to reimburse us as well. So that's why that's the way it is. So if they have a screen on that ballot, they have to pay what it costs the county, and hardware, we just have one machine. And then of course, sales of materials. And then the dog fund. We have to reimburse people sometimes. If they send a check in and it's incorrect.
No, that's the clerk's office costs of, like, the recovery that comes out of the dog license fund.
Okay, I wasn't aware of that one, okay, so you put that in there.
Well, no, you did, but I mean, you'll have to, that's where you would put your actual cost of what it is for, you might wanna relook at that.
Okay.
For your time and resources for collecting dog licenses and doing the reporting related to
That's
that.
quite a bit, yeah, I think we do wanna look at that. Okay. Cause that's Tracy's time. So we'd have to look at her payroll,
I would, track the hours that she spends.
she does that,
Okay, yeah, so
Okay.
figure out what the cost of that.
okay, so that'll change a bit. That's about it. Any questions? I get county board, I guess, right?
Okay, well, this is the dog license trust fund.
Okay.
So this is the collection of dog license fees and the related expenses that are, directly associated with this budget. And so then the fees that come in from that, some of it's transferred to the clerk's office to reimburse them for their time and resources related to those collections, and then the remainder is transferred to the animal shelter fund. So I think this needs, that a dollar amount, that $625 seems very low.
Yeah, so I do have to look at that, yeah. And we did put the 30,115 because of the dog license are supposed to be the fees are going up. So.
Yeah, and really so the fees that come in are the revenues at the bottom there, that 29,600. And then, we balance that budget to
Yep.
zero with the transfers.
I do.
For like this one or the county board.
My board. Pretty much left it where it's at because there's really no changes. Attorney fees, I don't know what you guys wanna do there.
So the attorney fees that got charged to this budget were actually help me remember this, it was for Andy Phillips in relation.
So, we had the open records request, that got charged, that one got charged to Rich. And then we had the RFP process for the hospital property, and this one got charged to county board, or was it vice versa?
I think it was vice versa.
Okay.
The open records one got charged here because it was the board that had requested outside counsel for that. And then we charged the one for the RMP to court counsel's budget because he would have otherwise been covering that, those responsibilities had he not had a conflict of interest. So that's why we were kind of thinking that we don't foresee conflict for 2025, so we think that attorney fees can probably be zero. And the copies,
I'd really like to get those down. Everybody wants a copy of the agendas and the minutes and the packet. So if they could just start bringing their laptops.
Ain't happening.
Well, then, you're gonna have to up the copies to 2,500, right?
mixed about.
What do you want that increase to? Yes,
That's
specific to
just a
county
big
board.
copy.
If it's black and white, it's 5.6 cents per page, and its color is more than double that.
Well, you got 2240 down for estimation for the end of the year, so you might as well go 23.
But if you look at 23, it's only 1,300.
One note in the corner per John Key.
But if we were at 1,117.77 for 6 months, I think that,
Depends how big the packets are,
yeah,
honestly.
Well, we get the one like we just got for highway.
Oh, yeah.
And that was charged to highway.
yeah.
Yeah, but still, like, that was a lot of paper.
There's some stuff we don't have to see.
That's why, that's why I print you guys like mostly just the minutes and the agenda.
Just enough to take some notes on.
We have to put that most important stuff in there, if you feel like we need to have it, then put it in, but otherwise, no.
Yeah, most of it, you pull up on the screen and everybody's looking at the same thing and you don't have everybody fumbling through.
Paper.
Mm-hmm.
We can do that. Can we do that?
Yep.
Just do the agendas and the minutes from now on?
You can do about
All
the resolutions.
Well, you have to do resolution.
You just give me a list of what you want. Well, exactly, so, sometimes we don't have something there, then you guys need it, so it's like, how do you pick what you want?
What you got to say over there, Mr. On your shoes?
I usually print my own stuff anyways before I come in.
What?
I usually print my own stuff before I come in, and I usually use my computer on top of that, so I won't let it open.
You never know.
It's job security for him, he wants that
Very
recycled
well.
paper.
Oh, yeah.
I take it back to the mill and I turn it into toilet paper.
Nice, you know.
That's great.
Yeah.
Very appropriate. In most cases,
You should just put a bin at the end of the door.
You know what he does with that budget afterward?
I'll just load it in the back of the truck and take it over there.
Right.
Yeah, we just throw it here. Like it. Back, on the back. Put a little paper slot in the back window.
Like a mail slot. Not for toilet. I want the recycled, the used toilet paper. I want the used copies to turn into toilet paper.
Let's wipe his butt with his budget. We hear that. Any questions or concerns on this one? WC as your subscription, that's,
It's got that, so.
just got that, yeah.
That's the normal, that's about the average, what it's been every year.
Yeah. It has not really
So it
gone.
hasn't went up much at all then.
No. No. So that's what like WCA to be part of that, you guys get those magazines and stuff like that, and, then you can be part of their mail, even their emails and council and, yeah, it's a really good asset. Lots of good information there.
Any other questions?
Quite simple.
Pretty simple.
Pretty straightforward.
One way to get that one down is just have a meeting every other month. Cut it in half. On the board one.
Yeah.
I don't think I'm gonna help. We'll have to buy cots for everyone to just take a nap.
So you're out by the end of this.
Okay, what's next?
Alright.
Alright,
Moving on.
do you wanna scroll to the, Annette emailed me back.
I was just gonna say, I've got a net thing here.
So it is supposed to be the 17,600 for the autopsy.
6,000 for the cremation fees.
Which I think we need to put in there.
6,000 for the cremation fees. So the bottom line for request 73,195, and proposed by finance 50,507.
Yeah, we didn't have that the formulas copied over, so. It should be the 73,195 for both. Can we go to the budget summary and look at what the bottom line is, cause we didn't have, there's a couple of, so we're up to 828.83 that we need to cut on top of getting 500,000 into contingency and getting that, used from general fund balance. I mean, we can move that 500,000, I think, for highway yet, but we have a lot of work ahead of us here. Cause I'm not, I mean, you should go up to the, used from general fund, I'm not at all comfortable with that 2,386,264. Cause that's what we'd be basically budgeting for a deficit to use from our fund balance. We need to get that number down to, and add 500,000 in for contingency, at least. Talking probably about $2 million. Okay, I think that's all the budget stuff that we had to cover today, unless you guys have anything else you wanna talk on that, then we can talk about the other part of the meeting, but.
Well, I think you gave us enough to chew on.
Okay. So John, do you guys we'll start with that part of the approval of the minutes?
Alright, moving into regular